provide an update on where we are with respect to COVID-19 for across the state of Maine for today, Monday, January 11th, 2021. And I begin today's update on a sad note. Maine CDC has received the reports of 6 additional individuals who have died with COVID-19. The 6 additional deaths reported today include 2 residents of Aroostook County, 1 resident of Kennebec County, a resident of Waldo County, and 2 residents of York County. 4 of the people who died were women, while 2 were men. One of the deaths was among an individual between the ages of 40 and 49 years old. Another was a person in their 70s, and 4 were people who were in their 80s. These deaths bring our total number of deaths associated with COVID-19 in Maine to now 438. I'd like to take a moment to offer our deepest condolences to the friends, family members, and communities of all of those who have lost a loved one to COVID-19. Right now in Maine, there are a total of 29,611 cases of COVID across the state. Of those, 24,679 are confirmed cases and 4,932 are probable cases. Overall, this represents an increase of 313 additional cases just since yesterday alone. Cumulatively across the state, 1,171 people have been hospitalized, and right now in the state, 195 are in the hospital. 58 of them are in a critical care unit, and 25 of them are on a ventilator. Among all of our cases, 3,137 are among healthcare workers. I'd like to turn now to where we stand with respect to testing. Right now in Maine, the positivity rate for PCR tests conducted is now at 5.72%. Thankfully, a number that has decreased just in the past 7 days. Some of that corresponds to an increase in testing volume for PCR, which now stands at 623 tests per every 100,000 people. Antigen positivity rates have held steady. Right now, the antigen positivity rate on a 7-day moving average basis is 8.07%, and the antigen testing volume is at least 191 such tests for every 100,000 people. Turning now to where we stand in terms of vaccinations. Overall in Maine, 55,775 people have received a dose of the COVID-19 vaccine. Of those, 49,794 people have received their first dose, and 5,981 people have now received both of their doses of COVID-19 vaccine. I'd like to take a quick second now to talk just a bit about a few outbreaks that Maine CDC is following. There's one in particular that I wanted to note. Just today, Maine CDC opened an epidemiological investigation into Pam's Playcare Daycare in Sydney, where we are aware of at least 10 cases. Again, as with all investigations, we are in the early stages of working with that facility to make sure that they have everything that they need to provide safety to those who work there, as well as those who attend. This involves making sure they're arranging for periodic testing, as well as making sure they've got the latest and most up-to-date information from an infection control perspective. Finally, before I turn things over to our colleagues in the media, I wanted to take a second to answer at least 2 additional questions that have come into us just since we spoke on Friday about where we are and for more information on the COVID-19 vaccine itself. One of the questions that we've received recently is whether someone who has gotten COVID-19 needs to be vaccinated. You might think that after you've had COVID, there's really not much reason to be vaccinated. But according to the latest data from the US CDC, those who have had COVID and recovered still should get vaccinated. And here's why. Although the body's own immune system produces some degree of a response after you've been infected with COVID-19, the early data from at least 2 of the vaccines that we have, those that are available in the US, suggests that the strength and duration of, the strength of immunity that is produced with the external vaccines, the ones made by Pfizer and Moderna, may be in fact stronger than the immunity that the body itself makes after having dealt with COVID on its own. And so for that reason, the US CDC recommends that even individuals who have recovered from COVID still be vaccinated. Now, do they need to be the very first folks in line for vaccination? Perhaps not. Because as we've seen, after you've recovered from COVID, the body, based on the data we've got, provides immunity for at least 90 days. But having additional vaccine on board is thought to boost the body's own immunity to make the body's immune system even stronger and protect against the possibility of COVID even further out. A second question that's come into us is around media reports of individuals who have been vaccinated for COVID-19 and then later went on to develop COVID a few days later. How could that be? How could someone get their first dose of COVID-19 vaccine and then a few days later test positive for COVID? Was it the vaccine that caused that? The answer there is no, it's not the vaccine. In many of those instances, if not all of them, what's happening is something that has now been something we've talked about before, but just in a new application. As we've talked about previously, individuals can be exposed to the vaccine, but not show any symptoms of having COVID for a number of days. Epidemiologists call this the incubation period, the time between when you were first exposed to a virus or a bacteria, and then the time between that and when you start showing symptoms. That incubation for COVID-19, that incubation period, can be several days long. During that time period, a small number of people may have been exposed to the vaccine, to the virus, and then went and got vaccinated. Indeed, one of the cases that I'm familiar with in another state is someone who was a healthcare worker who was slated to be vaccinated, but was probably exposed to COVID in the day or two before they were ready to be vaccinated. Sure enough, after they were vaccinated, they started feeling sick and were tested and were found to have COVID. But that's not because of the vaccine. It's because in this particular instance, the individual was most likely exposed before they got the vaccine. The vaccine just happened to be an intervening event. Had there been no vaccine, that person would have tested positive anyways. The vaccine, based on all the data we have, does not cause you to turn positive on a PCR test after you've received it. It will, however, potentially make an antibody test turn positive. That's not a bad thing, and it does not mean that you have COVID. The reason I say that's not a bad thing is that the way vaccines work is to stimulate your own body to produce antibodies. If we then later run a lab test to look for those, we should expect to find them. That does not mean you have COVID. The only test that can tell you whether you have an active case of infectious COVID-19 is a PCR test, not an antibody test. The COVID vaccine will not make your antibody test, your PCR test turn positive, but it may make your antibody test turn positive. That does not mean you can spread the disease to others. In fact, it means the opposite. It means that the vaccine is doing what it's supposed to do in helping your body spur along and create those antibodies that will keep you safe if you were to be exposed to the virus in the future. So with that, I'm going to turn things over to our colleagues in the media to take some questions today. And today's first question goes to Morgan from WABI.
Hi, Dr. Shaw. Thank you for taking my questions today. My first question is about the vaccination process. Is there any way, or will there be any way for Mainers to pre-register for the vaccine?
Morgan, we're working on that. We're looking into a way that folks can register even before their time in line has come up. Right now, we haven't sorted out a manner in which we can do so that then allows us to do something with that information. Meaning, if we're going to ask folks to pre-register, I want to be able to do something with that. I want to be able to say, now here is your time and here's where you need to go, and allow somebody to make adjustments to that. That process, it may end up being easier to just ask folks to register once the vaccine sites have come online, and then allow them to pick a time rather than assigning one to them right on the spot. So we're looking into that right now. We haven't made any final decisions, partly because we haven't really found an IT solution that allows us to get at that pre-registration piece in a manner that allows people to still have the flexibility to choose where we want to go. If we're able to find a platform that can do that, then that's definitely something we're into.
And my other question was also about the vaccines. If Maine were to get, let's just say, hypothetically, Maine was able to get enough of the vaccines to give everyone a shot, would we be able to handle that right now? What needs to be put in place to handle that?
Well, Morgan, let's be very clear. There is not a scenario under which in the next few weeks, any state in the country will be receiving millions of doses every single day or every week. The projections, at least as far as we are aware, are only going out 5 or 6 days, and none of those contemplate 1.3 million doses coming to Maine in the coming weeks, let alone 2.6 million doses that we would fully need to vaccinate anybody. So I understand where your question's going, but we should just be very clear. It's not likely to be the case that in the coming few weeks, there are going to be 1.3 million doses coming to Maine. That being said, there's no doubt that we will need to supplement the existing vaccination infrastructure to be able to deliver high throughput vaccines at a community level. There is no question about that. We are working right now with sites across the state of Maine to be able to offer that open, public-facing community vaccination so that folks can still sign up online ahead of time, but then move through those sites in high fashion. Based on what we are currently doing as a state, we know that we will need to make up even more ground once vaccines become more widely available. But right now, the main constraint on more widespread vaccination continues to be the supply of vaccine that's coming into the state, not so much our ability to get it out. I am going to turn things over to Steve Missler next.
Thanks for taking my questions. Can you hear me okay?
Yep, sure can, Steve.
Great. I guess first question, a short one, I think. Just do you have a status on the vaccination effort at long-term care facilities? How many doses you've received and how many people have been vaccinated? Understanding, of course, that that's being largely done through the pharmacy program.
Correct. Yes, Steve, I do. And I want to emphasize here that the data that I have are several days old. And that is because the retail pharmacy partnerships are only required to report to the state every 72 hours. That's not per an agreement that I've got with them. That is per an agreement that they have with the US CDC. And so the number I'm going to give you, Steve, is several days old. I am hoping, anticipating for updated numbers tomorrow, if not sooner. That being said, the latest number that I have as of last week, several days old, is that there have been 4,034 doses administered to residents and staff of those facilities. I've said it already, Steve, and I'm going to say it again. That number is undoubtedly higher But that is all that I can confirm at this time. We hope that tomorrow we will get reports from the latter half of last week, as well as from activity over the weekend. But the latest number that I have is that 4,034. In terms of, well, I want to make one really important point on this, Steve. I have expressed my concern over the rollout and the pace of that program. I've done so in these meetings publicly. Earlier today, my team, we were concerned that there may be vaccine that, again, that vaccine does not come into our possession. It is not sitting in our warehouse at the Maine CDC. It is being housed at the pharmacy's warehouses and earmarked for the state of Maine. We put the question to them of, are there excess doses on hand? And if so, what is your anticipated plan to getting those into arms? And one of those two chains indicated that they did in fact have doses on hand, and they could not tell us when they indicated that they would put them into arms. That didn't work for me. And so this morning I indicated that 1,950 of those doses that were currently at their warehouse should be immediately deployed to a hospital that I know can start using it immediately. So that process is underway right now. That's a tough call to make, but I am prepared and will continue to do that if we don't see that pace increase going forward.
Yeah, to your point, I guess I'm wondering how many residents are we talking about within those long-term care facilities, just for context purposes?
Yep, let me give you a really, really quick sense here. Of those numbers that I gave you, approximately 2,030 are among residents, and approximately 2,000 are staff. Again, those numbers are old. They will undoubtedly be updated. When we've got updated numbers, we will certainly share them, but that's the breakdown as of several days ago.
Okay, and can you say which hospital you've asked to redirect those doses to if they can't pick up the pace?
We asked those to be redirected to Central Maine Medical Center as well as to St. Mary's there. St. Mary's needed some additional doses, and Central Maine Medical Center was ready and able to vaccinate further healthcare providers. So that's where those 1,950 doses of Pfizer vaccine will be heading to, and I asked for that to be done ASAP.
Okay. And then the other question I have, and I thought of this last week when President-elect Biden had indicated that they want to ramp up, they want to pour more vaccine onto states, regardless of this scheduling of the first and second dose. And I know that there's some concerns about doing that, but it made me wonder, how often are you and your counterparts in other states in contact with the transition team, just so you get a bit of a heads up on this stuff and not learning it at the same time as we are?
Yes. We have maintained and have been in good contact with the transition team, as well as with Operation Warp Speed throughout the process. I have had the privilege of having numerous meetings with transition, not exactly in my role as Maine CDC director, but in my role as president-elect of the Association of State Health Directors. And so in that capacity, I've been privileged to have discussions of that sort. We've actually requested a special meeting with General Perna, I believe maybe even tonight, to talk more about this proposal from the incoming administration, what it might look like, when it might be actualized, and what the implications might be for states, so that we can brief out other state health officials on what it means.
Thank you.
I'm going to turn it over to Allison Ross next.
Hi, Dr. Shah. Thanks so much for taking the question. So are you worried about the virus spreading after the riot that happened at the Capitol? Just in the last few minutes, I saw that 2 more representatives have now tested positive. Do you think this could be a concern for our state as well?
Allison, I can't speculate as to what it may mean for our state, not knowing whether any Mainers were down in DC for those events. So I don't have insight into that, to be candid with you. That being said, in general, any type of large congregate setting of that nature, with folks not routinely wearing masks, being indoors for a long duration of time, being in extremely close proximity to one another, shouting, raising their voices, chanting, all of those things lead to or generate the preconditions that could lead to spread. I've read reports about those possibilities occurring. Now, to the extent to which they could be akin to what happened, for example, with the Sturgis bike rally over the summer, where cases were detected associated with that rally across a number of states, or whether they will be more delimited to other states, very difficult to know without knowing exactly the composition of folks who were there. But events of that nature have the qualities that may lead to high numbers of cases being transmitted.
And do you think the inauguration will qualify as an event like that, just because so many people will be gathering in Washington, D.C. in about 9 days?
I don't know the specifics around what the protocol will be in terms of distancing, masking, things of that nature. I know that the inauguration is not just a singular event, but rather a series of events. And so again, to the extent that folks are planning on making the trip down there for the inauguration and any of the activities associated with it, if you're planning to be at a dinner or any kind of gathering, the same things that we've talked about here in Maine apply with equal force down in DC, which is wearing a mask, maintaining physical distancing. Case numbers in DC have been on the rise. And so there is the possibility, the high possibility, that anyone who's going down for any of those events could absolutely come into contact with someone with COVID-19. You can't let down your guard just because you're going down there for an inauguration related event.
Great, thanks.
I'm going to turn it over to Don Kerrigan at News Center next.
Good afternoon, Dr. Shah. Thank you very much. A couple more questions about vaccinations. And one is, you gave the number, I think it was roughly 55,000 vaccinated so far. Out of how many doses that we've received? What's the latest on that?
Okay, so Don, I appreciate that question. And the numbers here the numbers go off in a number of different directions really quickly. Here's why. In order to talk about the number of doses that Maine has been allocated, you have to separate out the number of doses for that long-term care pharmacy partnership. About a third of all of the doses that Maine has received as of last night, 32% to be exact, have been allocated to that long-term pharmacy program. So as of last night, Maine had been allocated about 81,850 doses, all told. Of that, we and almost every other state made the decision to allocate about a third, in our case, 26,125 of those 81,000 doses to the long-term care pharmacy partnership. That partnership is designed to span over 40, 50, 60 days, but we front-loaded the entire allocation to provide security for the residents and staff of those programs, of those facilities, to know that when their clinic got scheduled on site, there would be vaccine available to them. That program is not under our control. Moreover, that commitment to front load all the doses was made at the outset. Those doses are not within Maine CDC's control. Of the doses that are within Maine CDC's control, it's about 55,000 or so. That's really the denominator that we look at. And as you mentioned, and there's a little bit of variation in these based on first doses versus second doses, but the number that we look at based on what is within Maine CDC's control to distribute, allocate, and earmark for different groups, for EMS clinicians, hospital workers, outpatient clinicians, that number as of last night was 55,725.
And so it sounds like pretty much all of those have gone out.
Don, there has been a myth that has circulated among other states, and I want to make sure that folks in Maine know that it is not the case here. There has been a myth that has come across in other states that there are large numbers of vaccine sitting on the shelves. And I want to be very clear. In Maine, what is happening is that there are no, the doses are not sitting on the shelves. Doses come in, they are allocated directly to hospitals, and we have worked with them to get them into arms as quickly as possible. Now, there's a little bit of variation in those numbers, Don, because they change hour by hour. And so depending on when you cut off the number, anywhere from 80 up to 92% of every dose that is within Maine CDC's control, 82 to 93%, again, depending on whether you cut it off at noon on Sunday or 6 a.m. on Monday, depending on when you cut that off, anywhere between 82 and 93% of every dose that has come into the state of Maine has been put into someone's arm.
And one other vaccine question, and then I'll be done. I got a call from a state legislator who suggested that legislators should be given a very high priority so that the state government can get fully, so the legislature rather can get fully back to work. What do you think of that idea? Has there been any discussion about whether they should have a separate priority?
I'm not aware of any specific discussions, at least within Maine CDC, around that. Certainly at the congressional level, I believe something akin has happened, but that is pursuant to a presidential policy directive. I don't know at the state level whether any state has an equivalent. I certainly understand the concern and the rationale that's being expressed, but I don't think we've made any decision around that. Just to be sure, Don, right now we are still really focused on healthcare providers, those who are on the front lines providing medical care for those with COVID-19, as well as the highly vulnerable. We're working on plans to vaccinate those who are at the highest risk for COVID-19, either getting it or dying from it. That's really where our focus is right now. We know that there are other considerations out there, but at least as to my team, we haven't broached the discussion about, for example, groups like legislators. I think that's something on the agenda.
Thank you.
Mm-hmm. I'm going to turn now to Ashley Blackford at WAGM.
Hi, Dr. Shaw. I have a couple questions for you. First off, I'm wondering if you have any updates on the outbreak investigation happening at some of the nursing homes or long-term care facilities here in Aroostook County.
Sure. Ashley, as we've talked about for ongoing a week now, the situation in Aroostook County has been of deep concern and, dare I say, one of our top priorities across Maine CDC. There have been a couple of updates that I will just touch on very, very briefly. One is that we continue to work with facilities, particularly around staffing. One facility in particular that was concerned and had raised their concerns with us was the Mercy Home. Thankfully, because of work that our team was able to help them do, they no longer have the same degree of staffing concerns that they expressed just a couple of days ago. That's a good thing and something that we hope to continue going forward. Another somewhat favorable report is that an outbreak that we had been concerned about at Presque Isle Health and Rehabilitation has now been closed because they had not had any new cases. At the same time, Ashley, that good news should not be taken to obscure the fact that our concern level remains high for many of the other open outbreaks that continue. For example, outbreaks at Northern Maine Medical Center, as well as other long-term care facilities in Aroostook County. That remains, again, one of our top areas of concern across the state. We're continuing to work with those facilities to make sure they've got everything they need in terms of testing, PPE, and general practices around infection control, also checking in with them very frequently to make sure that they are not running into staffing jeopardy. So much more to come on that. Some good signs that we've had some turnarounds on staffing and one such outbreak closed. But again, our concern level remains high, Ashley.
Okay, and we've heard from a few people who've received their second dose of the vaccine and they've had a more severe reaction as far as feeling sick afterwards. Are you hearing this is the case with other people?
So Ashley, let's in the clinical trials for both of these vaccines, it was well noted and described that to the extent folks may have muscle aches or fever, those were much more likely to occur after the second dose, not after the first dose. This is not an adverse reaction. It's not a concerning reaction. It is indeed how the vaccine works. The second dose is intended to be that booster shot, as we talked about last week. It's supposed to strengthen and fortify the body's response. The way that vaccines work is by showing your body a little snippet of something that's associated with the vaccine and asking your body to start priming the pump so that if it sees that again, it's ready to spring into action. That booster dose fortifies that. It shows the body that same thing again. And so it's not at all surprising, as with many vaccines, that the fever or the pain that, the muscle aches you might feel are much more common after the second dose than they are after the first dose. After the first dose, the body is naive to this, that after the second dose, it's ready to spring into action. And that fever that you feel is the body springing into action. This is not unknown. Those who are receiving the vaccine should be notified about this. That information is certainly on the manufacturer's website, and I'd urge everyone to take a look at that before they go in, but in no way is this surprising or concerning. And I probably should have added that question to my FAQs, Ashley, but thank you for giving me the opportunity to talk about it now.
Thank you for your answer.
I'm going to turn now over to Evan Pop.
Hi, Dr. Shah. Thank you. So you said it's likely that the new, more contagious strain of the virus will eventually spread to Maine. Given that, and given that we're currently seeing large numbers of COVID-19 cases, even with distancing and mask wearing mandates that are in place now, do you think that additional measures may need to be taken once that strain arrives? And specifically, wondering if the state would consider expanding testing, or whether it could change the COVID response in settings like schools or other places where lots of people gather.
Sure, Evan. Okay, sure. So let's recap as to where we are. That new variant has been now described and noted in a number of states. Just a few days ago, our colleagues in Connecticut reported 2 such cases associated with this new strain. As with any virus, the virus is going to do what it does, which is spread, hence why I believe it is likely to come here. Now, whether there may be any additional policy responses that accompany that, too early to tell. It really does depend on in what degree the virus does come here. You noted one thing, Evan, that I did want to pick up on, which is expanded testing. We haven't curtailed testing at all. Testing is still available at nearly 30 swab and send sites, to say nothing of several dozen Walgreens, and those are just the state-sponsored testing. So there are additional testing venues associated with physicians, hospitals, and other groups across the state. So I don't want to suggest, as may have been implied in your question, that we've scaled back on testing in any way. There are still no restrictions on who can get tested or whether you need to have any symptoms. You don't. There is a standing order that allows anyone to get tested at a Maine-sponsored swab and send site for free with no doctor's order. Now, whether there is any other policy responses that may need to be put into place, that's too early to tell. The initial reaction and response to the measures put into place in the UK did have some effect, but really it's even there too early to tell whether to what extent they were responsible for the slight downturn that has started happening in the UK. Again, I think as with so many things, it will not just be a policy response that's needed. It will also have to be all of us making sure we are taking the steps to stay safe from the virus. That's the most important lever that all of us can pull. We at the state can do things from a policy perspective, but the vast majority of the impact in turning the tide on the outbreak and the epidemic stands with each and every one of you. The personal choices that you make to wear a mask, maintain physical distance, avoid crowds, that's where the real action is.
Yeah, thank you for that. I didn't mean to imply that the state was curtailing testing. I guess I'm sort of just wondering if that would lead the state to do more sort of surveillance testing and testing to kind of more proactively.
Yeah, it's very possible. We are already doing a significant amount of cross-sectional testing. That is to say, looking at populations we know to be at high risk for disease or at high risk for spreading disease. Healthcare workers come top of mind, and testing them on a frequent basis. That is one reason we are able to detect so many of the outbreaks that we've got. It's also one reason, if I may say, that many of the outbreaks that we have in Maine, not all, but many of them start off with 3, 5, or 7 cases and don't rise to 50, 70, 200 cases, as happens with some degree of regularity in other states. I'm not suggesting all of them by any means, but because of that cross-sectional testing that we have been doing for months now, we're able to spot outbreaks before they get out of hand. Indeed, although I can't remember the exact ones, at least 2 outbreaks in the past 96 hours have been detected directly as a result of this cross-sectional testing. That's how we found out that there were at least 3 people, employees in the facility, who were positive. That allowed us to jump on the situation before those employees caused widespread transmission.
Thank you.
Over to Patrick Whittle next.
Thank you very much, and happy Monday. So kind of a specific question. We're seeing around the country a lot of sort of larger facilities like sports venues being kind of redeployed as sort of immunization centers, which is something that you talked about a bit could happen in the state of Maine. How close are we to having such centers here in this state, and are there any details available about where they might be and how it would all work?
Sure. Patrick, I don't have specificity around either of those questions right now for you. I do want everyone to know that we are working very intently on that. So Patrick, I wish I had specificity, but instead what I can offer are the principles that we are using as we are undertaking that planning. One of the principles is to find locations that are in areas of high population density, in areas of the state that have been hit hard by COVID. So that is areas that would probably be familiar to everybody here. York County, Penobscot County, Androscoggin County, certainly Cumberland, looking for places that we know there are folks to be vaccinated, as well as high rates of disease. The other principles that we're keeping in mind are it takes more than just having a facility of that nature. It's got to be accessible. It's got to be one where the location of it blends being able to be walkable, as well as not causing traffic jams if people are driving. There's also other considerations from an operational perspective. One facility that we looked at was promising, but it had way too many steps in it and not nearly enough access for those who may be elderly or disabled. Security is a consideration. So on and so forth. There's a pretty long list. They've got to have sufficient power supply to accommodate ultra cold storage. I'm not going to just list all of them, but Patrick, those are the considerations that we are keeping in mind as we're engaged in this process. Some facilities.
So it's clearly, right.
Yeah, some facilities have been promising, but as we went inside of them, it turned out they were dilapidated. So we had to go back to the drawing board. So it's in the mix right now. We're working on them. We're working on these not just to set up for a few weeks, as some places are doing, but for months and months. Because as Morgan's question earlier noted, this is going to be how we get up to that requisite level of vaccination that we need to be accomplishing.
So we're clearly still very much in a planning phase about this, is what it sounds like.
That's exactly right. That's exactly right.
Okay, good to know. Also, any thoughts on the sort of some of the pending tweaks to Maine State Health Law in terms of requiring insurers to cover testing and co-pays for testing, and some of the other modifications we're seeing in the new legislative session?
I've only just started reviewing, for example, LD1, and so I don't have much more to comment on that right now, Patrick. Again, I haven't read through it all and want to chat with my team about where we are. But certainly the concepts that are outlined there, making vaccines as well as all COVID-related healthcare accessible, not having fiscal issues, financing issues be a barrier to care. Those are, of course, the principles that we've held through and held true to ever since. As I mentioned to Evan a moment ago, for example, testing across the state of Maine, whether it be at Walgreens or Swab and Sends, has been available at no charge ever since we started setting them up. The Maine CDC laboratory doesn't charge facilities when we run tests. So those principles are in line, but having not reviewed all of the text of LD1, I can't really comment it on with specificity.
Okay, I appreciate that. Thanks.
I'm going to turn things over to Isha at the BDN next.
Thank you, Dr. Shah. I have two questions also about vaccines today. The first one is there a formula Operation Warp Speed follows to determine Maine's vaccine dose allocation? And if yes, can you share that with me?
Sure, Isha, what I have been told is that it is just that vaccines are distributed by Operation Warp Speed, allocated by Operation Warp Speed on a straight population basis. I haven't seen the spreadsheet that, you know, that rolls that up, but what I have been told multiple times by both US CDC and Warp Speed, it is just a straight percentage of the US population. So in our case, that 0.04.
Okay, thank you. And my second question is, I know you explained, you know, why someone might be testing positive for COVID-19 after getting the first dose, but have you heard of anything like that happening in Maine, of anyone testing positive after receiving the first dose? And also, what is the likelihood that someone after receiving the first dose might contract COVID-19?
Okay, I have received one email. I have not received any such reports from a clinician or a health system. I have received an email from one individual, I believe, who reported that they thought they had gotten COVID after their vaccination, but that's an unconfirmed report. I have not received that. I have not received any confirmed reports from any healthcare providers, you know, with lab tests attached and proof of vaccination attached. So no, I haven't seen that directly. It may have occurred. It's plausible, and for the reasons I outlined, but I haven't seen confirmed proof of it. Generally speaking, Isha, based on the studies that we've seen, one dose of at least the Moderna vaccine affords roughly about 50%, I believe the exact number was 54% coverage after the first dose, but it wanes somewhat quickly. How quickly? No one is exactly sure because the vaccine has only been around for a few weeks, if not months. But after that 2 doses is where you get into the 94-95% number.
Okay, do you know Pfizer's percentage after the first dose?
I don't know that offhand. I don't recall if it was discussed in the clinical briefing manual or clinical briefing book that the US FDA produced as part of their emergency authorization review. The Moderna one was actually published in the New England Journal of Medicine, which is why I'm familiar with that one. I don't know that number for Pfizer. It may exist, Isha, just to be sure. I just don't have it in my memory bank.
Okay, thank you.
I'm going to turn over to Kevin Miller at the Press Herald next.
Great. Thanks, Dr. Shaw. One quick clarifying question, then kind of more substantive questions. So the 55,775 doses that have been administered, does that number include the ones that went to CVS and Walgreens for the long-term care, or is that a totally separate number?
No, that is inclusive of those that went to CVS, Walgreens, long-term care. I subtracted out, in connection with Don's earlier question, the at least 4,034 that I can confirm have been administered to that. And so that leaves you in the non-long-term care world, you know, the remainder of that. But that roll-up that I provide of all doses administered at the top of the briefing, that is inclusive of everything reported to us by hospitals, clinical groups, as well as Walgreens and CVS. But again, their reporting window is 72 hours, whereas for everyone else, it's 24. That's not my doing. That is per the agreement that they struck with the US CDC.
Okay, but as long as I understand, that 55,000 does include the 4,000 that went to 4,000 plus. Okay.
Correct. Correct.
Great. So staying on vaccinations topic, are there plans to add more specific information to the vaccine dashboard? Similar to what we have with the COVID dashboard. Other states are posting things like demographics, ages of recipients, things like that.
Yep, 100%, Kevin. We have been working with a data visualization team, an expert who constructed much of the other parts of the dashboard, and we are we're in that process right now, and it's kind of in the rather unglamorous phases of making sure the data feeds work every single day so that they're automated, so Tableau can update it in real time and not have to do manual entry, and that's kind of the phase. But make no mistake, Kevin, we hope to have similar demographic data in terms of geographies of where folks are being vaccinated and other such things up on the website very, very soon. It can't come soon enough. We had started working on this, just to be sure, long before a vaccine came into the state, but to have data that is accurate, that's automated in real time, that answers questions that we have, setting up those visualizations is challenging. It's definitely underway, and we hope to have it up there soon.
So you're thinking next couple of weeks?
Hopefully sooner than that, but you know me, I'm not gonna promise a deadline. Hopefully sooner than a few weeks. But again, as you know well enough from working with me now for a year, I'm not gonna put a deadline on it. But for our IT data analytics team, this is probably one of the top priorities. Hopefully sooner than a few weeks.
Okay, great.
We've gotten the mock-ups of what the dashboard will look like, what the graphical visualizations will be. It really is now on kind of what I think of like setting up a stereo. You just got to make sure all the plugs are plugged in and all the wires are connected to the right outlets so that everything works seamlessly.
Great, thanks. And the Maine CDC guidelines, we're talking about vaccinations for phase 1A that we're in right now. Those are just guidelines, really. So, hospitals, pharmacies, they can make kind of individual calls about who they vaccinate. Am I correct? And the reason I ask this is because I think we've all received, some anecdotal reports of, say, hospital administrators who do not have direct patient care getting vaccines. So is there any does Maine CDC have kind of oversight responsibility for making sure that the vaccines that these hospitals are getting are going to people who really are at the highest risk? Or
Yep. So Kevin, there is a bit of a balance there, because on one hand, we want to provide guidance that is rooted in the epidemiology of COVID, such that those who are at the highest risk of contracting or dying from COVID-19 are the ones who are getting it. But there's also some degree of flexibility that we need to afford, such that, for example, many folks may have read in recent days horrific stories of vaccine being wasted because a hospital was scared that the health department was going to come down on them for giving a dose to somebody that it wasn't supposed to go to. There's also been, at the very same time, reporting done. One piece in particular in my mind was in the New York Times over the weekend, perhaps sort of what may have engendered your question, Kevin, about folks in hospitals that were generally low risk who received vaccine. I think we're going to be making some changes there to be a bit more prescriptive around where we want the vaccine to be going and into whose arms, to really underscore that our concept of operations is that those who are at the highest risk of contracting COVID, spreading COVID, or dying from COVID should really be where the vaccines are used. And we're thinking that through right now, and I foresee us making some changes on that in the very near future.
Great, thank you.
I'm going to turn things over to Amy Brown next.
Thanks, Dr. Shah. You said in the past that scarves and bandanas are not as protective as regular face coverings, but now that it's getting to be the time of the year when a lot of people are wearing scarves anyway, you're seeing more people just pulling a scarf up over their face when they go into a store. Are they effective enough that people don't need to be concerned if they're in a store where people are just putting a scarf over their face?
Amy, you threw in that word effective enough. And the answer is no, they're not effective enough. Are they effective? Yes, they do something. Is it better than nothing? It is. But is it effective enough? No, my answer, my view is that it's not. They do have some effect at blocking some of the spray that comes out of all of us. But, you know, I go back to what I've talked about before. If you can hold up your face covering and you stretch it out and you can see right through it, that means that the droplets that can potentially carry COVID-19 can similarly pass right through. And so scarves, bandanas, neck gaiters are not a substitute for a proper face covering. These coverings are widely available now. It doesn't have to be something that is gold plated or anything, or some of the craziness that I've seen. It can be a simple surgical mask that are available widely. It can be a simple set of a couple of pieces of cloth that are stitched together such that they provide multiple barriers. But no, based on the data that we've got, something that is see-through, that's stretchable, is not going to do the job as well as something that's dedicated for the task.
Right. I have another question, but just to follow up on that, do they technically satisfy the governor's requirements? So if a store owner sees somebody with a scarf across their face, should they be asking them to put on a regular face mask, or is it kind of a technical gray area?
You know, I believe, and I want to, this is, I'd have to go back to the plain language of the executive orders, but I believe we set forth what a face covering entailed. And so, Amy, I don't want to overspeak because I just don't recall, again, in my memory banks, exactly the language that we used around what constituted a face covering. But leaving that aside, the public health answer is that they're not cut out for the task. And so I think folks should know that when they go into a store, and that if a manager wanted to say, hey, you know, you really think you should have a face covering on, let me offer you one, that's the right path.
Okay, great. And the other question, the US CDC is reportedly investigating the death of a previously healthy doctor in his 50s who died 2 weeks after receiving the vaccine. And a listener got in touch and wanted to know what your thoughts are about the situation, if you're aware of it, if you think it's likely that his death was connected to the vaccine.
Amy, I'm aware of it. I've actually been briefed privately on this by the Secretary of Health of the state of Florida, who alerted me and my counterpart in Pennsylvania about this situation on Friday. Ultimately, that question of cause of death and whether it was related to the vaccine will be one for the medical examiner in Florida to make. I'm aware of the facts of this situation. At this stage, it really is too early to tell. What I will say is that in the tens of thousands of people who are enrolled in clinical trials around COVID-19, this type of low platelet count phenomenon that sadly caused this individual's passing was not noted. I'm probably going to talk about this a little bit more on Wednesday, Amy, but to provide a quick preview, what we're going to start seeing as we proceed through more and more folks getting vaccinated are instances of sad things that happen medically that may have happened otherwise, but now, because they have happened after a vaccine for COVID, there will be questions raised about whether that correlation is indeed causation. We need to be all on the lookout for those. Do they need to be investigated? Absolutely. But should they deter us from being vaccinated? Based on everything we know right now, the answer is no. But I'll probably have much more to say about that on Wednesday.
Great, thank you.
And to round us out for the afternoon, is Brad Rogers.
Here we go, Mike. Dr. Shaw, are there many cases in Maine where people are being charged for testing or treatment, including copays?
Brad, I don't have those data, to be candid with you, specifically around copays. What I can tell you is that with respect to testing, There may be instances where facilities, hospitals, providers are charging some degree of copay. I simply don't have those data. I can't rule out that as part of their normal testing operations, if you're going in for a medical procedure and you get a COVID test beforehand, there might be a charge associated with that to your insurance, and there may be a copay with that. I don't know the extent to which that's happening, let alone how frequent it is. What I can say is that for those who wish to be tested in Maine, the state-sponsored swab and send sites, of which there are nearly 30 now, as well as Walgreens facilities for folks who are having symptoms, are available statewide at no charge, no copay, no money exchanging hands whatsoever. What may happen within the parameters of a health system or a practice group, I can't speak of.
What about COVID patients in the hospital? Are they being charged bill? Are they being billed?
Similarly, Brad, it's possible. I can't really speak to what happens within the billing system between a hospital and a patient. I can't rule it out, but I don't have firsthand knowledge or the data upon which to really answer your question accurately or truthfully. I'm sorry.
Okay, thanks.
So, but thank you for raising that, and certainly a topic I know is on a lot of folks' minds right now, especially today. Before we wrap up for the afternoon, I wanted to touch on one other aspect that has come up with respect to vaccine administration. We talked a lot about that today, and I hope that by providing you the numbers around what Maine has received within our control to distribute versus what has been allocated to residents and staff of long-term care facilities, I've dispelled the notion that there are doses, boxes, thousands of cases of vaccine somehow sitting on a shelf in Maine that we haven't distributed. For the most part, vaccine comes into the state and we aim to get it into arms as quickly as possible. But there's another element of this story that I urge everyone to keep in mind, and that is equity. Let me put it this way. If the only thing that we cared about was getting shots into arms as quickly as possible, and that was the only metric that was of concern, we would send vaccine to 1 or 2 large population centers, to just 1 or 2 hospitals within those, and ask them to move forward as quickly as possible and just vaccinate people in those major metropolitan areas. Because we could probably have moved a little bit more quickly. But velocity is not and has never been our only goal. Equity matters as well. That's why we have made deliberate decisions to send vaccine to other parts of the state, from Fort Kent all the way to York. Hospitals in those areas have received vaccine. Can they match the throughput that large tertiary care centers in Portland and Bangor can? No. But that's okay, because it also means that folks across the state are getting access to vaccine. Does that mean that the throughput is what it should be or could have been? No, but that sometimes is what equity looks like. I stand by that decision. I'd ask everyone, when you start reading and continue to read stories that say that Maine is behind or that we're moving too slowly, it's important to ask not just how quickly we're getting vaccines out, but to whom we are vaccinating. I'm proud of the fact that in Maine, we have achieved one of the highest rates of vaccination of any state in the country thus far, and we've also done so by keeping a clear and open eye on health equity, making sure that how quickly we vaccinate is balanced by whom we are vaccinating. I believe we can continue to do both and accelerate the number of vaccines that are being put into folks' arms. As I hope we receive more and more doses in the coming weeks, my pledge is that we continue to try to push those out as quickly as possible. So with that, I thank everyone for your time this afternoon. I appreciate everyone tuning in today. As always, we will keep you updated on where we are as information comes into us. In the meantime, as always, please be kind and take care of one another. We'll talk again on Wednesday. Thank you.